To understand the pelvis, we are going to talk about the basic feature of the bony pelvis, what we are expecting to learn from the bony pelvis, and then on we are going to talk about these particular features which we must know, must understand in pelvis or in bony pelvis. So this particular picture, as we are seeing in this like a projector, is a cross section, a sagittal section, which is showing the side of the human body. Now, which is exposing the cavity that we have, like thoracic cavity is partitioned with the abdomen cavity by the D diaphragm, as you are seeing there. And this particular D diaphragm, which is limiting this particular thoracic cavity, and then we have the beginning of the abdominal cavity, which is going down. Now, this abdomen cavity, as it enters to a lower part of the body, which is getting into a bony cavity. That particular bony cavity we are going to learn nowadays or now onwards, we call them as pelvic cavity. Now, this particular pelvic cavity, we call them as, because it is lying between these pelvic bones. Now, what we are going to learn here, what do you mean by this particular pelvic bones and how this particular bony pelvis is formed, and what are the clinical use of this particular pelvic cavity to understand this particular dimensions or diameters of the pelvic cavity. Now, this particular picture, as you are seeing here, the abdominal cavity is shaded in the purple. Now, after that, this particular abdomen cavity goes down to the cavity, we call them as pelvic cavity. It is lined by blue, and then it ends at, and the lower part is lined by this particular orange. So, these three colors are there that we must appreciate in this particular picture. So, these particular three colors are basically representing the three abdominal spaces or regions. The top one, the purple one, is the abdominal cavity proper that we have learned so far, which exposes this particular greater sag, lesser sag, contents and everything on. Then as we are going down, we are going to see this particular blue space down there. That particular blue space, we call them as the pelvic cavity. And then outside to it, we have an orange space. That's outside this pelvic cavity, the orange space we call them as perinium. So these three entities you must have an idea. What do you mean by the abdomen cavity or abdomen cavity proper? What do you mean by the pelvic cavity? And what do you mean by the perineum? Now there is a demarcation and separating line between this abdomen and pelvis. So abdomen and pelvis is demarcated or separated out by an imaginary line that we call them as pelvic brim. Now we have to know what do you mean by the pelvic brim and what makes this particular imaginary line pelvic brim. That we are going to learn. And then the lower end of this particular pelvic cavity, we call them as pelvic cavity proper, is lined by a space or lined by a partition. We call them as pelvic diaphragm. So we have to learn about pelvic diaphragm, and that particular pelvic diaphragm is separating between the pelvic cavity and that particular space we call them as perineum. So if I am rolling the cursor, if you can see that, we may be guarded by this particular desk. You may have to stand up to see this space. This space we are talking here is the abdomen cavity proper, and then we are ending up into this particular continuous space down. We call them as pelvic cavity. The pelvic cavity holds this organ. We call them as pelvic organ. That we are going to learn. And then this particular lower limit of this particular pelvic cavity is made by a diaphragm, which is a physical partition present. We call them as pelvic diaphragm. Under this pelvic diaphragm, we have a short, very narrow area over here. We call them as perineum. That particular perineum is visible from external side, which is the skin line part. We have that, and this little bit space they are existing in here. So these particular regions we are going to learn here now on. We call them as pelvic cavity. Now to talk about this is the same picture representing in a coronal section, the different section as you are seeing here. That's what I am saying, that's what I am talking. So thoracic cavity is separated from this particular abdominal cavity by this one, this diaphragm. We call this big diaphragm as the diaphragm. Then we have the abdomen cavity proper that we have learned. So this abdomen cavity ends into this particular cavity, draws down to here. So this particular blue line lies here. We call them as pelvic cavity. That's what we are going to learn here. The organs which is placed within this particular space, we call them as pelvic organs. Now the lower limit of this particular pelvis or the pelvic cavity is made by this V-shaped structure. You see this V-shaped structure, it looks like a hammock. Now this V-shaped structure, which looks like a diaphragm which is above there existing on it, it is hanging in the pelvic space, we call them as pelvic diaphragm. So we have two diaphragm. Above diaphragm, we call them as the diaphragm or abdominal thoracic diaphragm. And a diaphragm separating from this particular pelvic cavity to this down space, we call them as perineum, we call them as pelvic diaphragm. So this is what you have to understand. Now this particular pelvic cavity is present in these two bones and the backbone on the back side. We have two hip bones, right and left, which is fitting on sides, and posteriorly we have a bone, we have the sacrum, which is forming this particular bony pelvis. So this is what we are going to talk here about this particular bony pelvis. So this is the articulated pelvis that you are seeing. This is our projections of this class. So two hip bones are there, right side, left side, fitted in between a bone, we have the sacrum. So together we call them as bony pelvis, also known as articulated pelvis. So this articulated pelvis we are going to learn today. Now this particular articulated pelvis, as you are seeing here, having an imaginary line existing to it, which is denoted by this red mark. That red mark we are seeing here, we call them as pelvic brim. So this pelvic brim is this round ring that you're seeing here. We call them as pelvic brim, which is a circular or kind of like a oval or like a posteriorly indented oval structure which is lying here. We call them as pelvic brim. Pelvic brim is also known as pelvic inlet. They are synonymous words that can be used. So pelvic brim, B-R-I-M, brim, and this pelvic inlet, they are the same words. Now what makes this pelvic brim? So what makes the boundary of the pelvic brim? This is an imaginary line that you are drawing. So this is the sacrum bone. So this middle point of the sacral bone, this border we call them as promontory. On the side of the promontory, this is expanded. We call them as ala. So this promontory of the sacrum, then moving on the sides, ala of the sacrum. Then we have this line. We call them as pectinate line, which is going to this particular tubercle, pubic tubercle. And then this point which is having here, which is known as symphysis pubis. So between this ala and this hip bone, we have a joint here. We call them a sacroiliac joint. Between the sacrum and the hip bone, right and left sacroiliac joints. So these are the pelvic brim which is formed like this. Sacral promontory, ala, sacroiliac joint, and then pectinate line which is going on this line all over here, pubic tubercle and pubic brim, pubic crest, and then we have a joint here. We call them as symphysis pubis. Then it moves to the other side and makes this particular circle complete. So this particular bony pelvis makes this imaginary line. We call them as pelvic brim. Now this pelvic brim you have to demonstrate in the bony specimen that you are giving in examination. How to just like explain this particular pelvic brim or pelvic inlet and how it is formed. This is what we are expected from you. Now what this particular pelvic brim or pelvic inlet makes, this pelvic inlet or this pelvic brim splits this pelvis into two halves. Above we call them as greater pelvis. Below we call them as true pelvis. So this particular pelvic brim splits this particular pelvis into two halves. We call them as greater pelvis and lesser pelvis. The lesser pelvis is also known as true pelvis. So this picture as you are seeing here, this is the line which is transversely running. This line is pelvic brim. Now above this pelvic brim, on the top of this iliac bone over here, we have this piece of space we call them as greater pelvis. And under this, we have a false pelvis or true pelvis, which is, under to this, we have this pelvis, we call them as lesser pelvis or this particular pelvis proper, which is lying here, the abdomen or pelvic organ is placed here. So, this particular pelvis is divided into two halves by this pelvic brim into greater pelvis and the lesser pelvis. Lesser pelvis is also known as true pelvis or the pelvis proper. Now, the lower limit of lesser pelvis is made by this diaphragm, we call them as pelvic diaphragm. So, this lower part have got a diaphragm or muscular partition which is separating this particular pelvic cavity to the outside space, we call them as perineum. So, again coming back to this particular picture here what we are studying. So, this is abdominal cavity proper, then we have this greater pelvis, then we have this pelvic brim, under this below this pelvic brim we have the true pelvis, and then lower limit of pelvic, true pelvis is this pelvic diaphragm, and outside this we have this space we call them as perineum. So, this orientation you must have to go to this particular chapter that we are going to learn is pelvis. Now, coming to this particular pelvis, bony parts of it are which is formed by two bones, right side hip bone, left side hip bone. In between them we have the sacrum making a joint in the posterior side, right and left. We call them as right sacroiliac joint and left sacroiliac joint. And this particular pubis bones in the middle and the front, they are making a joint, we call them as symphysis pubis. So, together it has three joints to hold these bone things together, two on the back, one in the front. Now, there is a difference between these two joints what we have mentioned. This anterior joint is intervened by a cartilage in between. So, we have a cartilage which is made of fibrocartilage which is placed inside. So, this makes this particular joint is a cartilaginous joint. Now, there are two varieties of the cartilaginous joint that exist. We call them as primary and secondary. So, this variety of this cartilaginous joint we call them as secondary cartilaginous joint because this cartilage remains as it is. So, this joint which is present in between here we call them as symphysis pubis is a kind of joint which is a cartilaginous joint which is a secondary variety. So, this is your exam question. We are often asked this question. No matter how easy question you ask, we do not get the answer, and that is why you do not make a pass marks in the examination. Now, coming to the joint on the back side, this joint between this hip bone and the sacrum, right side sacroiliac joint and left side sacroiliac joint. That means the ilium bone makes an union with the sacrum bone, right side and the left side. Now, these joints on the back side are a synovial joint. That means it has a synovial membrane. It's a tiny amount of synovial fluid lives in there. We call this as joint as a synovial joint. The synovial joint, the hallmark of it is a mobility possible joint. That means there are mobile joints which is present on the left back side. So, these are the two basic types of joint that you have to learn about this particular pelvic joints that you have learned. So, sacroiliac joint is a synovial type of joint and it is stitched or joined by ligaments. We call these ligaments as sacrum to join the sacrum to iliac joint, we call them a sacroiliac joint. One is on the front side, we call them as ventral sacroiliac ligament and the dorsal sacroiliac ligament. These are the two ligaments which is primarily joining these particular joints. And then from this particular ilium to this lumbar bone, we have this ligament, we call them as iliolumbar ligaments. And again between this particular bone we have a ligament which is later ossified, we call them as interosseous ligament. So, you can forget about these names of the ligaments, no matter, but you cannot forget the type of the joint you are delivering. So, what kind of joint it is and what is the special feature about this particular joint that you must have to utter to pass in examination. So, this particular joint we call them as synovial joint, sacroiliac joint, right and left, two of them are joints are there. And diseases involving this particular joint we call them as sacroiliac joint problems or sacroiliitis. Second variety of joint that we have mentioned in the front side between these pubic bones, right side and left side. This joint intervened by a cartilage and that cartilage remains there for rest of our life. That is why we call them as secondary cartilaginous joint. How many varieties of the cartilage joint we have? Two varieties, primary and secondary. What is the difference between primary joint and secondary cartilage joint? The primary one ossifies, becomes bone. The secondary one, the cartilage remains at ease. So that's why we call this as joint symphysis pubis joint, which is a fibrocartilaginous joint, which is secondary cartilaginous joint. These two also supported by ligaments, which is running between this particular symphysis pubis, right side, left side. But again, we are not emphasizing the ligaments, but we are emphasizing the type and the variety of the joint and the mobile possibility of these particular joints. The synovial joints are mobile joints. This cartilaginous joint is less mobile or no mobile joints. Remember this difference, it does have mobility of these joints. Now coming from these particular joints, we are going to talk about this particular pelvis again. So this is where we started. Pelvic brim, also known as pelvic inlet. So what do you mean by the pelvic inlet? That's what you have to mention, that you have to narrate here. This pelvic inlet is an imaginary line, or also known as pelvic brim, which is running from the midlines, sacral promontory, ala, sacroiliac joint, and then we are going to this particular pectinate line, which is existing and reaching to this pubic crest, to the sacroiliac, to this particular symphysis pubis, then to the opposite side. That makes this particular joint a circular, oval or indented oval kind of line, imaginary line. What is the significance of this pelvic brim? It separates the pelvic cavity into two halves, above and below, false pelvis and true pelvis. Again, this is an imaginary line, that's why you're seeing. Now, this particular thing, we call them as pelvic inlet. That means, this particular pelvic cavity, which is a bony cavity, which is present in here. So, this particular inlet is basically letting this particular doorway so that we can get enter to this particular pelvic cavity. That's why this one is known as pelvic inlet, or that is letting the way towards this pelvic cavity. Now, if you have inlet, you must have an outlet. The outlet is on the opposite side. So, this outlet of this pelvis is on the opposite side, which is like this one. So, this pelvic inlet and pelvic outlet, and in between them exists the pelvic cavity proper. So, this is what we have to narrate and demonstrate in the pelvic cavities class. Now, this is what you are seeing here is the bony pelvis, articulated. Individual right side, left side, that you have to understand. The midline bone, we have sacrum. So, this has to be placed posteriorly. This is anteriorly symphysis pubis. This is how it is placed. Now, the anatomical position is that you have to grab this particular sacrum bone on the back side, and then you have to tilt it down like the way, holding the sacrum in anatomical position. Holding the sacrum bone in anatomical position is an easy thing to do, because it's just like picking up sacrum from ground. So, it will be dipped down. So, this is the normal anatomical position of the bony pelvis. Now, you have to identify the different parts of it. Alright. Now, once you have this, you have to identify the pelvic brim. Pelvic brim is starting from the symphysis, sacral promontory, ala, and then you have to roll it down, sacroiliac joint, pectinate line, pubic crest, symphysis pubis, and to the opposite side. So, this is what we are seeing here is pelvic inlet. Here, then it enters to this space, we call them as pelvic cavity, and then we have this pelvic outlet. This is what we are seeing in this picture. So, this is what we are looking right now is the pelvic outlet. So, pelvic inlet is an all round bony cavity, bony boundary. Pelvic outlet, you see that on the sides and the front and the posteriorly it has bones. Rest of them, you don't have bones in them. So, this difference of pelvic inlet and pelvic outlet that you have to carry. The diameters of the pelvis. This is what we have to learn. This is the last thing that we have to focus in this particular region. Now, what do you mean by diameters of the pelvis? Now, you can measure this particular pelvis in different directions. You can measure this pelvic inlet from the symphysis pubis to the sacral promontory. as well as you can measure it from the sideways and obliquely. So this is what we call them as diameters of the pelvis: anterior, posterior diameter, transverse diameters, oblique diameters, etc., etc. So this anterior posterior diameter of the pelvis, which is running from the symphysis pubis to this midpoint, we call them as sacral promontory. So if you are measuring this diameter, we call them as anterior posterior diameter of the pelvic brim. Now these anterior posterior diameters of the pelvic brim can be measured in 3 spots. You can measure this diameter anterior posteriorly from above here, from the symphysis pubis to the sacral promontory, following this black line. Then we call this line which is coming over here as anatomical conjugate or diameter. You can measure this diameter from the bottom of the symphysis pubis to the sacral promontory, following the green line. We call this line as diagonal conjugate or diagonal diameter. And then you can measure it from posterior or middle of the symphysis pubis to the sacral promontory, following the red line. This red line you are seeing here, we call them as obstetric or true conjugates. So these 3 lines of measurement of this anterior posterior diameter that you have to know. What do you mean by this anatomical conjugate? What do you mean by the diagonal? And what do you mean by the obstetric conjugates? Conjugates means diameters. Now this posterior limit is the fixed, which is sacral promontory. The anterior one is on variable position. From symphysis pubis top, bottom and the middle of it, you are measuring it and you are getting the length. This length we call them as conjugate. These conjugates are important for obstetric measurements. When you go to learn about this obstetrics and the gynecology, they will come back to this particular class again and ask about this particular conjugates and how to measure and what the significance of it. Now we are not going to learn this anatomy or the gynecological or obstetric significance of it right now. Only thing we know about this particular conjugates, what do you mean by this, and what this particular thing is measured from what anatomical landmarks. So again, we are measuring the diameters of the pelvic inlet, and this particular inlet means anterior posterior diameter we are measuring here, and emphasizing on these measurements on measuring from the anterior to posterior side. We call this as a conjugates. From 3 points we can measure this particular anatomical length: symphysis pubis to the sacral promontory, and the symphysis pubis from 3 points we can make a measurement: above, below and middle of it. And 3 different points we get 3 different lengths. So these 3 names that you have to know: anatomical conjugate, and then we have to know diagonal conjugate, and then we have to know these obstetric conjugates. So these are the 3 things that you have to know besides this particular pelvic brim or bony pelvis. So this thing you have to know about this particular bony joint or this articulated pelvis. You have to know about this particular, what do you mean by this greater pelvis and lesser pelvis? What are the significance of this pelvic brim, also known as pelvic inlet? What do you mean by the greater pelvis and lesser pelvis? And then what are the different bones and what are the different joints present into this particular bony pelvis, and what are the natures of these joints? And then measuring the diameters on the pelvic inlet, specifically this particular measurement, which is anterior-posterior diameters. What do you mean by these 3 conjugates: anatomical, diagonal and obstetric conjugates? And what are the landmarks, how they are measured? Okay. So this is all about this particular anatomy of this particular articular pelvis and related thing, which is we have to learn to go into beyond this particular classes which are going to follow. So this is all.